Well, good morning. Most kids who do contract COVID won't get extremely ill, but for those who do, they end up in the hospital, and doctors say if they get the vaccine, they most likely won't end up there. It's been 2 months since children ages 5 to 11 were cleared for the vaccine. Since December 19th, only 19% of Michigan children in that age group have been fully vaccinated. There is not a day that goes by without Dr. Bashara Faraj and his team treating a child severely sick with COVID.
It really breaks my heart because I look at these kids and I think, these kids should not be in this ICU bed.
Studies show most kids who get sick with COVID will not need medical intervention. Dr. Faraj says only 2% will go to the hospital or in urgent care, but there are 3 categories of patients he sees consistently, and that's young teenagers with severe acute COVID, typically overweight with respiratory failure, and they need oxygen and steroids. The second category is multi-system inflammatory syndrome. There's mild or no symptoms initially, but 2 to 4 weeks after exposure, patients develop high fever, vomiting, diarrhea, and or an inflamed heart. And the third reason, children are at the hospital for another reason, but they get tested for COVID and are positive. Christian Wispy's 9-year-old son had COVID last year. Wispy described it as terrifying, and at that time, the vaccine was not available for children.
We had several 911 calls, shortness of breath, he couldn't breathe, vomiting, couldn't keep any food down, high fevers, body aches.
It took months for him to recover, and now, Wispy's entire household is vaccinated, and she's encouraging others to do the same.
Again, experiencing COVID in my home, it changes things.
Now, it's unknown why that some kids do end up in the hospital and get sicker because of COVID-19. There are studies that are being done, but doctors here at Beaumont say the best way to prevent against severe illness from COVID-19 is to be vaccinated. Reporting in Royal Oak, I'm Peter Maxwell, 7 Action News.
All right, vaccination still so important, as you mentioned, at this time. Thank you, Peter.